Welcome to the Global Pulse, a short video series where our experts break down a trending topic in international business and why it matters to you.
Hi. As we think about how well our public health IT systems are enabling us to combat the coronavirus, there are several areas which we can focus on. One is the scale and scope of use of these systems. What is the nature of their use? What types of systems have been implemented, from electronic health records to registries, surveillance systems, and how have they been operationalized in different areas? What's their extent of use? We have situations where some systems have been stood up, but because they've never been used sufficiently, they're not able to provide the value we need. We can also think about the quality of these systems in a couple different ways. So if we think about the system quality, so how well is a system able to meet the goals of the different users towards the pandemic? And then importantly, what's also the information quality in these systems? In a global environment where we're relying on data flowing not only at the national level, but across countries, that quality of information is key. We have situations where in certain countries, the underreporting is expected to be very high, and then those models built upon that data end up creating inaccurate models in areas that are now being subjected to coronavirus. We also need to think about through the interoperability and standards of these systems. From the High-Tech Act in America years ago, a number of standards were put in place, and that's been helpful, but we're still running into challenges where different systems aren't able to communicate with each other across clinical environments to public health environments. I think we also need to think about how geared our public health information systems are for innovation. I mean, the ability to rapidly experiment, try things out, communicate those findings to one's networks quickly is a key enabler in this time of a need for rapid innovation. And I think finally, in brief, as we think about what's the community infrastructure that's been put in place. In Maryland, for example, we're lucky that we have a statewide health information exchange that's allowing for tracking of hospital admissions, types of admissions, discharges, transfers, and other information which allows us to more rapidly assess where capacity gaps are going to be needed and send those resources there more quickly. I mean, finally, I'll say the pandemic has highlighted the value of data visualization and how that can be communicate information to vast audiences. We're able to see across countries how the rate of transmission of coronavirus has been impacted by different interventions, stay-at-home orders, and so forth. Having that data readily available allows us and those that are now facing the virus to have evidence-based ways to select interventions and combat that. And also it helps from a public point of view and understanding to put pressure on political leaders where that there's been a slowness to adopt things that can battle this virus. Thank you.